I hit on this idea that Google had tremendous success with internet search. So taking the massive amounts of information on the internet and looking at using the structure of the internet, what are people linking to, for example, and using the things that people link to decide what's relevant, what's most important. Follow the links and see where they converge. And what I realized is that you could take that kind of approach and apply it, instead of web pages, apply it to data and ask across all the world's data, where does it point to a specific answer to a scientific question? And so is there more in the data than we're currently seeing? So does the data actually point us to answers that we weren't aware of that might not even be in the text of papers? So long way to say there's this really interesting idea, this new approach. Ended up leaving Novartis in 2017 to found Plex. And here we've been building a system to really take that to use that on a tremendous scale. So there'll be a figure with 1,000 or 1,000,000 data points, and then we'll summarize it with a sentence or two, right? So somewhere we know that we're missing out, that we are not capturing even the tiniest fraction of what we've collected, the data we've collected, the tiniest fraction that is actually turning into knowledge. And we know that, but I don't think as a field we know what to do with that. We've spent literally decades yelling at scientists or berating the scientists for, again, the list of not enough data, good enough data, not annotated enough, not the right type of data, on and on. There's only so much you could do to change the scientific enterprise itself. This is complex stuff that scientists are measuring and capturing. There's a reason why it's been so hard to make it uniform, especially in this space, in biology and drug discovery. So that's why we're so excited that we think there is an answer, right? From another field, right? Internet search. There's an algorithmic approach that really addresses this, that can unleash just an unfathomable amount of data that we've already collected, that's sitting there, that could be reused if only we could figure out how to reuse it. And now we have a method that can reuse it. We are not making predictions, for example. Strictly speaking, our platform is just finding things. It's finding data. And it's just returning for your question. Here is where there's data, the most data. Here are the kinds of things that data most points to, most converges on. And here is that data for you to interpret. We are allowing scientists, basically giving scientists superpowers, giving them a capability to find things that they otherwise couldn't find. And once they find them, because we're providing all the details, they can evaluate it. They know what to do with it, right? We've been around for almost 8 years now. We've worked with more than 40 companies. One example that we've been talking about, so we collaborate with a group in University of Michigan, Johnny Sexton's lab at University of Michigan, and they run phenotypic screens. They ask, can I find some that have the effect on my biology that I care about? So I'm going to try each one out and see if it does the right thing to my cells that indicates a potential therapy. Right. So we were working with them and taking their compounds that are hits in these kinds of screens. So one of them focused on liver biology. So one of these compounds seems to be promising as a way to treat fatty liver. Works in mice, but again, they don't know how it works. They came to us, we put it in our system, and we said, these compounds, the chemical structure of these compounds is similar to these other compounds here that we found out in the world in all these databases. They tested both of them. Actually, the first one confirmed inhibition of that target. So one of the mechanisms that we proposed, they confirmed, and they presented that data in a conference in October in London. Ultimately, I think all this leads to more effective precision medicine, more effective, basically discovery of cures, right? Because when we discover a new therapeutic mechanism, that's what we're doing. So what a focal graph is, we take this big knowledge graph, which could be just absolutely massive and incredibly diverse. And what we do is we pluck out from that a subgraph, a piece of it that's relevant to your question, to your query, right? So now you go from an absolutely massive graph to a far smaller, probably still big, but way smaller subgraph, this focal graph. And you've plucked out the bits in such a way that you've captured the bits that are most relevant to your question. Right. So if you care about chemistry, then you pluck out the bits that have compounds with a similar structure. Yeah. So it's not to say we don't need to go back to the bench and keep generating more data, but the data that we've already generated is just filled with all kinds of discoveries waiting to happen, all kinds of results, that many of which could be quite compelling. You have a largely autonomous scientist that can plan research programs, can execute them, can do this at scale, and can deliver novel findings that no one knows, and the data, the experimental data that supports them. So again, not a suggestion based on papers it's read, but actually findings based on the data that we've collected, and provide the actual data and all the details and the methods it used, right? What the research program was, the strategy used, all of these things. So it really, I think it foreshadows a potential truly autonomous AI scientist, which I think is incredibly exciting.